You can take as many painkillers as you like, but they don't work. Just don't work at the end of the day. Struggling to get out of bed. Some days my wife would have to put my socks on because I couldn't get down to get it because the pain in my hip was too great. Then I would struggle to walk down the stairs one leg at a time. I had to buy a van because it sat higher so I could get in it and drive to work. And even my friends noticed that I weren't the same person, that they could notice a change in me. I wasn't as happy-go-lucky. No matter how hard you try to say it doesn't get you down, it does get you down. And the people that are closest to you are the ones you tend to take it out on. Yeah. I saw the ITV Tonight programme, looked at it, spoke to my daughter, spoke to my wife, spoke to my son. We researched quite a lot of places. Yeah, me and my wife decided Aire because once I'd spoken to Dr. Linnand, he put my mind at ease. He really, really did, because I had a list of questions to ask him, and he answered them without hesitation, without a thought, you know. And he said I could ask him any question I want. I asked him all my questions. Once he'd answered them, he was then interested in my hip I'd had replaced twice. He was interested in my back surgery, and then he discussed with me how he thought. He had a A plan, a B plan, and a C plan. And he said, when you get here, we will have 3 plans on the table. So we will cover every base for you.
He was the biggest factor for you to come here?
Yes, once I'd spoken to him. And the package. But the rehabilitation is what also led me to come here. Because it's all right having the surgery, you need to have that rehabilitation to get yourself going. Because no matter what you do at home, if it hurt, you won't do it. But if you've got someone who can show you and push you, then you do it. I would tell people you need to have the rehabilitation. Don't come and just have 2 days, 3 days, get on a plane and think you've got to be perfect, because you won't. I've had 2 hips done on the right-hand side, and I know what it's like not to have the rehabilitation. And I wanted to definitely this time have someone that can show me what to do and help me. If I sat and told you that I weren't afraid, then I'd be lying to you, because I was afraid. Yeah, I'm not going to deny it, I was. Even though I had 2 hips done before and a back surgery. You can be the biggest person in the world, but you'll always be afraid. You'll always have that little niggly doubt in the back of your mind. Yeah, fine, yeah.
Well, yeah, that's quick.
Yeah.
You feel tired?
No, not at all at the moment.
But
You can keep them if you like.
Okay, we will sort something out.
Hi,
Hi.
Dad. How are you?
I'm good. How are you? This is the question.
All right, yeah, not too bad.
Yeah, how's the hip? How's the pain?
I've just got pain in there. when
In
I
the
walk.
incision region.
Yeah, just in one particular spot.
Okay. So the changes that were inside the joint and they were as expected. So
Yeah.
you needed the surgery, you know what happened before with the right one, and it's the same for the left. Everything went according to plan. So now this is before the surgery, like we talked about, and you knew all the stuff. And this is after.
After, yeah.
So you have the ball and socket, you
Yeah.
have the stem. It's quite the same, that's on the right side.
Yeah.
So we did not use any screws because it's not a revision surgery. Usually we can get
away
without those.
Oh, he's got no ego. No ego at all. No, he's the sort of gentleman that you would pass in the street and he'd say hello to you and you wouldn't know who he was. He's very unassuming. He doesn't to me seem like he crave for the limelight. He likes what he does, he enjoys what he does, and he's very down to earth, very natural, and he has his patients' welfare at heart. You can see it when he talks to you, when he discusses things with you. He's human. He's human.
What can you tell about Mr. V?
He is a man that when you first see him and you get to know him isn't what you think. He's virtually down to earth, but his biggest asset is he will push you. I would say now I'm further forward in 7 days of rehabilitation than I ever was having my other 2 hips done on the right hand side. In terms of what I can do and what I can't do, I am further forward now than I was at them stages. We bought a dog 3 years ago with the plan that we would take him on holidays and walk. Well, I haven't been able to do that. He's now 3-year-old and I haven't been able to walk him far at all. When you can't walk your dog. You can't just walk across the shop. Or we went on holiday this year with the whole family and I've got 2 granddaughters. To be able not to jump in the pool, swim with them, walk down the shops with them when we were abroad, it's them sort of things. You know what I mean? It's just simple little things that you can't do that you miss the most. But hopefully, well, I don't say hopefully, I know this will give me that back in my life.
And this is how this video should really end, Alan, but I know you're watching. Hi and hello to your family as well. We have some unresolved business, or a puzzle really.
No, it was not the surgeon. It was a...
It was a surgeon. It was a surgeon.
His surgeon.
I have
Yes.
it on camera. It was the surgeon.
Lena?
Yes, Lena.
You wait.
This is the exact moment we talked about.
So you're quite young, and the doctor is here. 1 minute and I will give you him. 1 minute.
And I know that camera is showing only Venus, but if you listen closely, I say, oh, the man of the hour. And this is how I call the surgeon, Dr. Linnas. So it was most definitely 100% the surgeon. I know this does not make any sense to the rest of our audience, but if you ever come here to have your hip or knee replaced and you meet Venus, you will get it, trust me. And if not, I will be the first one to explain. Best wishes for you, Alan, and your family from our whole team who met you and treated you. I hope you will live your life to the fullest. Bye!